Evangeline Canlas once again, and I am a spa director and a farmer. I am back here at CSA for my Frown line treatment. So now I'm back for my Frown line treatment again. And for the last 2 years, I have seen the improvement of my forehead. So today, Dr. Contessa is going to use a new technique and a new machine for my Frown line treatment. Don't forget to click and subscribe CSA.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest. Let's all welcome back Ma'am Evangeline. Yay! So, 2 years ago, we had a repeat procedure of the treatment of the so-called deep glabellar lines. And right now, after 2 years, Ma'am Evangeline, how are you?
Oh, doing good. I'm
Yay.
happy with my forehead.
Yes, okay. Because, our clients here also want to look natural and just appropriate for their age. That's what they're sharing with me, okay? Because way back, that was 5 years ago, if you remember, Ma'am Evangeline, when we started the treatment for you. Actually, I still have the picture where you have that deep line here on the forehead. So the single glabellar line there, it was really that deep, dented. There was volume loss and tissue atrophy there. And I think the remnant right now, it's just the scar, linear scar on the surface, right, Ma'am Evangeline? So we did before, during the first treatment, a combination of hyaluronic filler plus PDO threads during the first time. Plus, we need to relax the muscles also with our injection of botulinum toxin. And then 3 years later, you returned to us and we did another injection of the PDO threads. But that time, we used the braided PDO threads.
Yes.
Plus injection of botulinum toxin. And after 2 years, Ma'am Evangeline is here to show us she's still happy with it, okay? So the thing is, we were able to elevate that dented part. It's just that on the surface, we just have this etched line. So ano na lang, scar na lang siya. Okay, but we didn't do any procedures. Actually, I was recommending like laser resurfacing or some microneedling to still improve the skin surface to kind of smoothen it further. Because we did the treatment in the inside layer. So actually with these kinds of glabellar lines, the very deep glabellar lines, we really need to do combination procedures, okay? Because aging is not only in the skin surface, it's also inside, deep within. Because aging is multi-layer factorial, or several layers of our face tissues undergo the so-called aging. So hindi lang po sa surface, but also inside, even the bone. The bone. There's bone resorption over time as we age. Nag-shrink yung bone.
Yeah.
Yes, then the muscles weaken or add weight. Even the fat tissues, they shrink, and some of the fats, they just go down or sag down. And then the skin, we lose the collagen, elastin, hyaluronic, and there you go, the aging. Plus, concern ni ma'am yung mga, sabi niya sa akin, age spots from the aging process. And of course, here in the Philippines, because it's always, I think it's like all throughout or almost summertime, or it's sunny here, although there are months that are rainy seasons, okay? And with the sun exposure, we get these pigments on our cheeks. So what we're gonna do for Ma'am Evangeline today is we'll do PDO threads again in this layer here in the glabellar line, and also inject with our botulinum toxin to relax the muscles. Plus, we will combine another procedure, a new device that we have here at the CSA. We'll show you when we return. And we're back. So we're doing the glabellar dip line for Ma'am Evangeline. Okay, so we're working on the upper third of our face. Okay, so it's gonna be in the center or the midline aspect of the forehead region. And here in these areas, the layers that we have to avoid where you have your blood vessels is the so-called layer 3. So if you remember your soft tissue layers of our face, from the skin to the subcutaneous layer, and then we have the fibromuscular or SMAS layer, and then we have a deep fat and the supraperiosteal layer. Okay, so the blood vessels actually that we're avoiding are in your supraorbital and the supratroch layer. So for example, if you palpate for your supraorbital here, it's in this part here, and then 1 cm medial to that is your supratroch layer. Okay, same thing here, palpate supraorbital, it's here, and then 1 cm your supratroch layer. So these are like blood vessels that you have to avoid when you're doing injections in this part of our face, the upper third. Okay, so since Ma'am Evangeline has just a single line of that glabellar fold here, okay, the furrow. So actually, I'm looking at it, it's even on the surface. It's really just the kind of linear scar only. So we still want to improve this and of course maintain. Okay, Ma'am Evangeline, we're doing a so-called maintenance treatment just to prevent it from becoming deeper again. It's because aging is continuous. Okay, so we have to do something to still maintain the effect of what we've done in the past. So imagine it's like the first one 3 years, then the first one 5 years ago, the second one 2 years ago. So see, it's not bad, right? So we're working on the center here. This is gonna be the one that I will be filling in. So I'll be using again a PDO braided type of thread. Right now we call it PDO Bomb. Okay, so it's a braided type of a PDO, and I'll also be relaxing the procerus muscles procerus muscle and the corrugator muscles of Ma'am Evangeline using my botulinum toxin. Okay, so as with any injection procedures, we clean the area. Okay, we have to disinfect. Then we also applied topical numbing cream a while ago, your EMLA or your lidocaine cream. Leave it there for about half an hour, and then after that you can start with the procedure. So I'll be still doing an injection of my lidocaine, so you can still spray your pain freeze. Okay, so good thing we still have this cold spray. There you go. And then after that we can inject the entry point with our lidocaine, minimal amount of this one just at the entry point here, and then I'll make a tiny prick, a puncture using a gauge 21 here. Okay, there you go. And then I have my PDO bomb here. It's a braided type of PDO, multiple strands, like 8 strands in one cannula. Okay, so sponge please. Okay, so our entry point is here. Okay, ideally I place this bevel down and then directed it into the subdermal layer. Okay, so since we are on top of the dorsum of the nose, so we're just gonna glide it there. So subdermal layer. Okay, that's one. So before we use only 3 pieces, so same thing now, 3 of this cannula loaded with those several strands of your PDO threads. Okay, so after this we'll be doing the so-called injection of our botulinum toxin, second one, and this is the third one. The last time our entry point was at the superior line, so this time you can also use the inferior line as your entry point. Actually it's this line here that's still dented, so I started on the inferior aspect of the edge line. Okay, so we're done with the insertion of those PDO threads, braided type of PDO threads or volumizing PDO threads. We'll proceed with our injection of botulinum toxin to relax the muscles. So this is now the Botox or botulinum toxin. Okay, we just wanted the bleeding to stop there. Actually, I'm already seeing an instant elevation using the volumizing PDO threads. So you can actually suppress on that and then inject into the procerus here. You can use 2 to 4 units, and then 2 units in the left corrugator belly, and then another 2 units in the right corrugator belly, and at the tail 1 unit, and another tail 1 unit. Okay, so I've done the treatment, maintenance treatment for the glabellar line, the deep glabellar line. Now we'll be adding another procedure. We have now here in CSA the so-called BellaPro device. Okay, it's like a microneedling device whereby if you want to treat those scars or those like superficial lines and wrinkles, because Ma'am Evangeline has on the forehead those lines, wrinkles, okay? If you're not into injecting too much of your botulinum toxin, because the problem with botulinum toxin when we have this droopy eyelids, upper eyelids, because you're weakening your elevator muscles, the more that your droop eyelid will, you know, it's kind of like, ma'am, you're potentiating that droopiness of the upper eyelid because you weakened already the elevator muscles when you inject your botulinum toxin. So in cases like that, there are other treatment modalities that you can do. You can actually even do your thread lifting here, or you can also do the so-called microneedling treatment, whereby you target also those fine lines, those wrinkles. You want to improve the skin superficial layer, target the fibroblast cells to stimulate production of your elastin, your collagen, and even your glycosaminoglycan. So we wanted to target the dermis layer where you have the supply of your support structure proteins in your connective tissue dermis layer. Okay, ma'am? So this is the new device that we have right now here. So it has actually, the tip has 9 pins there. And at the same time that you're doing your microneedling, you're infusing some peptides, amino acids, vitamins, minerals, micronutrients that your skin dermis will need. Okay, so the BellaPro here, it's a microneedling device with infusion of your micronutrients. You can also use your exosomes, your growth factor peptides, stem cells, and other solutions. And you can even combine with those non-cross-linked hyaluronic substances and other skin boosters that you may have. If you have the NCTF, if you have other hyaluronic molecules, you can actually place them in your syringe here. And this one has this 9 micropins here. So it's also like your mesotherapy. It's also like a meso gun, okay? So since in the center glabella part, I did already Botox injection, so we don't want to massage that area. So I'm just gonna work on the lateral aspect of the forehead here where I have some lines here. Actually, in this part of the, like the superior part of the eyebrow, we cannot inject Botox here. So this is a no-go zone for your Botox here. So lateral to the mid-pupillary line and into this, within the 1 to 2 cm above this lateral bony orbit, superior lateral or bony orbit. So we can treat this line here. So I did injection of the Botox a while ago here. So I'll just work on this part here and on this part there. So I have my pain free, so we can spray. And this is an instant numbing, okay? So ma'am, I will just press on this one and then there's the device. There you go. There. So just a simple technique like that, you can work on this skin part here, areas that you still have your lines, okay? So I'm using a 0.8 millimeter on the forehead aspect, okay? There you go. How was it, ma'am? Parang tiny pins lang. So you can actually target even this part here, but because I have injected a Botox there, this is gonna be my maintenance for Ma'am Vanji, that we can do this like, for example, once a month and finish like a 5 session for her on this kind of treatment. So I'll just finish this side here, so you can work on the temple area also if you wanna improve the skin here, regenerate the skin, okay? So this is a technique that's like this. It's so simple. At the same time already, ma'am, we're delivering micronutrients. And if you have melasma or solar lentigens or pigments on this cheek areas, you can actually use this to infuse your whitening solutions. Ma'am, tina-target ko na rin yung pigments niyo po, okay? So we'll do this part here. So I'm working on the periorbital region, and then when we change the part of the face, we can actually increase the depth of the needles, the pins, the micro pins. Okay. So I also want to target the under eye to get rid of those fine lines in the under eye section. Okay. There you go po. Tolerable. Si mataas ang tolerance. Okay. So we'll proceed to the cheek area, and then the lower face, we can actually increase the depth. So paint freeze. So we can make it 1.6 to 1.8, or the others even use 1 point higher than that, like 2 to 3 millimeters. If you have those deep acne scars, we can actually use deeper or like higher depths for our microneedling. Okay, I'll proceed at this part. Okay, okay pa si ma'am. Okay. So we're using a 3 cc there, and then the injection time is like a 3-second rule. Probably we can make it 1 second later on. So we'll just finish with this. So we're done with our microneedling treatment for Ma'am Evangeline. We'll show the result when CSA Medical Aesthetics return. And we're back, so we'll now show the result to Ma'am Evangeline. Here's our mirror po. Ma'am Vanji, hold lang po here. There you go.
Wow.
Yes. So we did the insertion of PDO braided threads into the glabellar decline, and also we did injections of Botox in the procerus and the corrugator muscles, and we combined with our BellaPro microneedling with infusion of our micronutrients that include your amino acids, vitamins, minerals, hyaluronic, even some growth factor peptides there, and other micronutrients. How was it, Ma'am Banji?
Medyo masakit, pero okay din.
Yes. Actually, to be honest, with the microneedling po, she didn't even use like a topical numbing cream, okay? And these are micro pins, 9 micro pins, tiny pricks. You'll sense the sharp pricks, right po? But you were able to tolerate it. So, it was just that the whole face was not totally numb with your numbing cream. Ganyan po kataas ang tolerance ni Ma'am Banji. Okay. Even I tried the device too without numbing cream. But so far so good. If you have high tolerance to pain, you're okay, right? So if you really totally apply the numbing cream po, whole face, and like leave it for longer number of minutes, like even like 60 minutes po, much better po yung numbing, okay? And actually a while ago, we were like, some parts we sprayed with pain-free, some parts we don't. But so far so good po. So after that treatment, expect a transient erythema or redness, temporary redness, and usually within the day, the redness will go away. Actually, the redness was reduced already, right? To like how many percent? 50% na po, exactly. And then in a little while, it's gonna go away again. And then the thing after this procedure, when we do some microneedling, we advise as much as possible, avoid muna sun exposure. And also, you will only use like gentle cleansers for the face. And then like in the morning, you can put your sun protection, and at night, your repair peptide creams or your mild moisturizers. And then, kay Ma'am Banji, what we're gonna do is to give her a maintenance treatment of that microneedling BellaPro. Okay, yes po. So, after 4 weeks, we can repeat the procedure to treat po yung linear scar. So, because before we've been doing a treatment inside the tissue layers. So, right now po, yung linear scar na yon, that's the one we're targeting with this microneedling. So, with that micro-injuries, what you're doing is you're stimulating your dermis fibroblast to synthesize your new collagen matrix formation. So, you'll regenerate, you'll repair from the dermis layer to improve yung surface and also somehow eradicate that scar. Ayan. So, this is the concern. Plus, also those static wrinkles on the forehead. So, she also has this more particularly on the right frontalis. This part po, right forehead area. And there is also on the left side. Okay po. But the one on the right, I noticed it's longer. Right, ma'am? So, actually, I still did like a second pass to third pass on the right side of the forehead. And we also targeted the pigments. Okay. So, if you have those melasma or any pigmentation, you can also use the device to infuse your whitening solution in the dermis layer. Okay. The pigments may be in the epidermis or in the dermis. So, if you want to reach the dermis, this is a device where you can like deliver whitening solution. Nasa loob na po sila. And then, yes po, usually within the week, we're starting to see like, for example, if you infuse brightening solution, gradually there's like a brightening effect. And plus the collagen synthesis starts on the 4th week. Okay, that's why after 4 weeks, we can again do the treatment and maintain na rin po for further improvement and further regeneration and to keep Ma'am Banji younger looking. She's 60, never mind, late 60s. Yan po. So, but she looks still, in her age po in her age, I could say na natural beauty, plus just appropriate for her age. Okay po. Thank you, Ma'am Banji, for like giving us your time and sharing with our followers, with our televiewers, and also like, of course, yung journey ni Ma'am Banji started like 5 years ago pa. But the thing is, na-amazed din po ako kasi the first time I saw her, super, ano po talaga, lalim. It was so dented. It was really atrophic. Okay? But right now, 5 years later, still, naka-elevate pa rin po yung dating naka-dent, yung dating nakalubog. So, naka-elevate pa rin sa surface. Yun lang nga, we were mentioning na yung sa surface, parang scar na lang. That's why po, I also advise my other patients na do prevention na rin. Like if you see dynamic wrinkles, you can already treat it with your Botox so that the dynamic wrinkle will not become the permanent wrinkle or the static wrinkle. So we don't need to use other kinds of treatments na po. Prevention is better also.
And it will delay your aging process.
And delay the aging process. Kasi nung time namin nila Ma'am Banji, kasi all these treatments, of course, they're very new, right? Nung time natin kasi, ano lang po yung alam namin, right? So, in the past kasi, it's all like surgical procedures, and yung mga ganitong treatments po. Pero, of course, in the Philippines, yes po, in the Philippines, we just had them like this couple of years din po, okay? At least we're updated with what's latest, and we're maintaining and taking good care of ourselves, loving yourself, okay? God is good all the time. So, God is beautiful. So, let's keep this beauty inside and out.
Inside and out.
Thank you so much, Ma'am Banji. Any message po sa kanila?
Thank you, CSA by Dr. Contessa, for your beauty enhancement.
Yan. Right now po, busy si Ma'am Banji sa spa, training mga therapists. Yes. Yan po. God bless po. Wellness massage. Ayan. Kung gusto niyo i-try, and then visit natin si Ma'am Banji.
Yes, Golden Passes Spa.
Yes. So, if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Malagul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do also watch the other videos, the old episodes for Ma'am Banji. It's in our YouTube channel, Contessa Salvador. And please do subscribe. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.